I'm Tammy Quinn.
And I'm Beth Heller. We're the co-founders of Pulling Down the Moon and the authors of Fully Fertile and the Infertility Cleanse.
Today there are so many mind-body techniques available to patients, and many like acupuncture, mind-body groups, and even nutritional counseling have been shown through research to be beneficial for the fertility patient. This video is actually meant to help educate you on yoga for fertility and how new research suggests that a 6-week program may actually lower anxiety rates in fertility patients. I think most of us can agree that the average fertility patient tends to be stressed and perhaps a bit anxious.
I know I was.
Beth and I are both former fertility patients, and we can attest to some of the challenges of the journey. Dr. Alice Domar published research that showed psychological symptoms like stress and anxiety associated with infertility are similar to those associated with other serious medical conditions like cancer, HIV, and those doing cardiac rehabilitation. It's amazing, Beth, isn't it, really, to understand that most people don't realize just how much stress the average fertility patient is under.
I know I felt it when I was going through it, but to see it in hard numbers is really striking.
The data is striking, you're right. There was also an article that ran in Fertility and Sterility. In that article, it said that psychological factors are the #1 reason that couples did not finish 3 insurance-paid IVF cycles. When patients are unable to complete a course of treatment due to stress or anxiety, it stands to reason that their IVF outcomes may be lower. And Beth, how many times have we heard from reproductive endocrinologists, if I just could have kept that patient in treatment a little bit longer, I know I could have gotten them pregnant.
Yep, and how many times have you had a yoga student come up to you in class and say that yoga was a big part of feeling hopeful enough to try one more time?
Exactly. As a result, we feel like more and more physicians and patients are looking for a way to incorporate integrative care techniques into their medical treatment plan. The 6-week Yoga for Fertility program includes 4 key components. They are the postures, coping tools from yoga philosophy, breathing and meditation techniques, and community support. Beth's going to tell you a little bit about those yoga postures.
Yoga postures are just one part of a broader yoga wellness system that includes breathing, meditation, and teachings from yoga that help us deal with the stresses of life. To the outside observer, yoga postures may just look like crazy pretzel stretches, but a trained yoga instructor knows that poses can be chosen for their effect on both the physical and the emotional body. As of yet, there isn't research into these specific effects of the postures, but yoga has been used therapeutically for thousands of years. Poses like forward folds release tight musculature in the back body and are believed to have a calming effect on the emotions. Back bends stretch constricted chest and abdominal muscles and are traditionally thought to energize the practitioner and relieve depression. Hip and groin openers release tight pelvic muscles and for this reason may increase the blood flow to the pelvic region and to the abdomen. For women using ART, postures can be chosen to release pressure in the pelvic area, to support digestion, and to relieve anxiety. In fact, we just conducted a study at our center with Fertility Centers of Illinois that found that participants in our 6-week Yoga for Fertility program experienced significant reductions in anxiety.
The process of fertility care can be very stressful and create a lot of anxiety for patients. So the opportunity to do yoga has provided them an outlet to really reduce that stress. Being active, of course, is very healthy and very important in fertility care and outside of it. But when you're undergoing IVF and ovarian hyperstimulation, vigorous exercise can actually be dangerous to the health of the ovary. So we do want people to really reduce that level of intensity, and yoga is a great opportunity. If you're going to consider yoga, you want to do it under the care of someone and instruction of someone who is learned in this process and understands the risks and benefits of movements along with where their ovary is in the process of stimulation. Very strenuous yoga is also something that we need to be careful about, and being active but not too active, vigorous exercise and hot yoga can also not be appropriate in the field of IVF care. The new study was done with Fertility Centers of Illinois and Pulling Down the Moon, and that looked at women who were undergoing fertility care who did yoga for a 6-week course, and it was state and trait anxiety was followed in these patients, and it was really reduced with the opportunity to participate in this 6-week program. I think it's really important for the people involved to be familiar with the IVF process and the medications so they can really guide the level of intensity of that yoga experience. It might be a good idea to interview your yoga instructor to make sure they know what they're instructing you to do if you're an IVF patient.
The posture practice used in this research is a style of yoga called gentle vinyasa flow. In this practice, poses that support fertility are linked together into flowing sequences. As women learn the sequences, they begin to focus more and more on the sound of their breath, which leads to a state of moving meditation. Meditation and breathing are also an important part of the program. Research shows that both meditation and breathing practices have many practical benefits, which may include improvements in the biomarkers of stress regulation, a reduction in pain, increased positivity, and improvements in sleep.
While much of what we do is based in traditional yoga teachings, there's a growing body of clinical evidence that shows yoga to be beneficial for many different health concerns, including back pain, for lowering cortisol levels and managing stress, and even lowering blood pressure.
And now there is new research suggesting that a 6-week yoga for fertility program may reduce anxiety levels in fertility patients. We welcome and encourage many more studies to come.